views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
And hello, everyone, and welcome to Open. I'm your host, Daren Jaime, and we are inviting you to take a look now. Because as the year comes to a close, it is time to take a look at some of the most memorable segments we work hard to bring you right here on our show. We try to keep our viewers up to date with coronavirus news, politics, health, wellness, and a whole lot more. On this edition of Open, we're reviewing just that, taking a look at some of the best during the year 2021. So stay with us because all this and much more is heading your way. Right now, we're officially open. Hello, everyone, and welcome to Open Wednesday. I am Daren Jaime. Of course, we thank you for joining us. And yes, we also want to welcome our viewers on Manhattan Neighborhood Network as Open is broadcast live simultaneously on the MNN channel. Now you can stay connected to us on our social media platforms at BronxNet TV and also at our website at bronxnet.org. The COVID-19 pandemic has led to a dramatic loss of life across the world and presents an unprecedented challenge to public health. Particularly here in New York, food systems, jobs, and individual lifestyles, New Yorkers have had to adapt to a new normal. Many have actually considered leaving the state due to the effects of the COVID-19 pandemic. We spoke to freelance reporter and master's candidate at the Columbia Graduate School of Journalism, Bahar Ostadan. She talked about this very issue. Let's take a look right now.
Thank you for having me. Appreciate it.
You know, it's an interesting statistic, and when you really think about it, you say, okay, some people don't want to take the vaccine, got it. But to say that you're actually leaving the state of New York, that's some pretty interesting news.
Absolutely. I mean, like you said, we've already seen an influx of New Yorkers moving to Florida more so than usual throughout the pandemic, people seeking, looser COVID restrictions and wanting to send their kids to school in person as opposed to virtually. So we'll have to wait for the data to come in to see how many people actually did leave the city as a result of these mandates, not only to Florida, but to neighboring, Connecticut or Pennsylvania or other places that people might have family networks.
We know also that, Connecticut and the tri-state area, they really haven't adopted that policy as of yet. No telling as to whether or not they actually will. I know that you've done some reporting really specifically on this whole vaccine hesitancy issue. Tell us a little bit about what you found in your reporting.
Sure. So I think the fact that people are leaving is really indicative of a larger problem and a larger question of why people are hesitant to get the vaccine. So my approach was really just to talk to as many people as would speak to me, going door to door, where people are, laundromats, hair salons, lines, anywhere people are waiting and willing to talk, and just ask them, what are their thoughts around the vaccine? And if they're not vaccinated, what are the reasons for that? A few things surfaced in my interviews with people. I guess the first that is really troubling, especially someone who works in media, is people seem to be ingesting a lot of inaccurate information and regurgitating that to their network. So the rumors that we've been hearing about, the vaccine affecting fertility or the vaccine itself killing people, which we know are not accurate, are really prevalent in a lot of neighborhoods. And so that's really worrying people. And so that's causing people to actually fear the vaccine, I think, more than the virus itself, which is a big problem. And I think there's a lot of work to be done to combat that's going around.
So you would say there's a great spread of misinformation amongst the people that you're hearing when it comes to really details about the vaccine.
Absolutely. Yeah. And I think what's unique about the Bronx in New York, as we know, is that this is a group of people, New Yorkers, the residents of the Bronx, that are really different from people in other parts of the country who are against the vaccine and also against the mask, and also, might be denying the virus itself. So that's not the group that we're talking about here. These are people that were really, really affected tragically by the virus. And most of the people that I interviewed actually have lost loved ones to COVID themselves. And even so, like I said, are more fearful of the vaccine than they are of the virus. And so I think there's a lot more reporting that needs to be done to unpack all of this. I think it would be really interesting to report on someone's journey from the day that the vaccines were actually released, and follow what was their decision making like, what information were they presented with, had they seen doctors, did they have access to people giving them accurate information, so that we can start to understand some of the shortcomings here in terms of medical systems and local government.
I found there's an interesting statistic as it pertains to the Bronx. When you talk about Bronxites and those who actually with boots on the ground, who are residents of the Bronx, a lot of people who actually live in the borough of the Bronx are actually essential workers. And when you talk about this vaccine hesitancy, you're looking at essential workers per se, who are saying, even though we're on the front lines, we still have some hesitancy here. Absolutely.
I think that question too drives us to the question of who had access to the vaccine when it was first released. And some essential workers did for that reason, but a lot of people couldn't take time off of work to get the vaccine, to recover from the vaccine. They didn't have the medical benefits or the technological infrastructure to go and find those appointments and the time to sit and scroll and hunt for the appointments the way that a lot of other New Yorkers had the privilege to do. And so I think it begs the question of sort of how does access drive hesitancy? And that's something that I don't think has been addressed so deeply in the mainstream media. I think there's, you see a lot of mainstream outlets pointing to historical medical harms like the Tuskegee experiment, and sort of evading the present day medical harms and the present day shortcomings, and how a lot of neighborhoods in the Bronx are really medically under-resourced in terms of even number of general practitioners.
So where does your reporting take you from here? Obviously, these are some very key statistics, and startling in some ways when you look at the fact that a lot of people, and you say 32% more than actually this time last year, are heading particularly to Florida. Where does your work take you next?
Yeah, I have the same question myself. I've been trying to keep in touch with the people that I interviewed and just check in with them. Hey, have you decided to leave? Some of the people that I interviewed did, in fact, they chose to stay unvaccinated and lose their jobs. A lot of them are trying to start sort of small businesses at home with, graphic design and other things that they can do remotely. But I definitely will continue to try to talk to as many people as I can, like you said, with boots on the ground, because I think it's sort of a dangerous situation when, as we know, the Bronx, at least in terms of national media and even New York City wide publications, is a really undercovered borough. And the danger of that is that when it is covered, the way in which it's covered carries a lot more weight. And so I think as much as I can, and as much as we can as reporters, to talk to as many people and represent how people are really feeling is important to getting the truth out.
Yeah. Well, Bahar, Host Daren, thank you so much for being with us, sharing some very vital information. Of course, we too will continue to follow the story. We'll probably get you back here to give us some more details if you have some more findings. But thank you so much for joining us.
Great. Thank you so much. It was great chatting with you.
No worries. And listen, if you want to find out more information about her work, please go to her website, baharostadaan.com. Want you to stay with us. We got more show coming up. Open continues right after this. And welcome back to the show. The COVID-19 pandemic sparked dramatic shifts, particularly in the healthcare industry, including the way providers can prescribe, receive, and view prescriptions. Pharmacists and providers quickly pivoted to help people get the medicine that they need, and it's likely that technology will play a new and important role as we move forward. We spoke with the operations manager at Mount Carmel Pharmacy, Javier Maldonado, who gave us more insight on this particular matter.
A pleasure to be here with you.
Good to have you. Introduce us to an independent pharmacy. We know about pharmacies, there's Walgreens, there's CVS, but when you talk about an independent pharmacy, how do you define that?
So you look at the independent community pharmacy as that beacon of hope in the communities that they serve. When you look up and down the block, it's in many cases the one professional establishment that individuals can go to. In regards to access to healthcare, pharmacies and pharmacists are quite frankly the most accessible providers in the healthcare system. And when you think of doctors and when you think of going to your clinics and going to the hospitals, you need to have that insurance card in order to actually see a doctor or be seen by a doctor. Otherwise, you have out-of-pocket expenses. When you think of your local community pharmacy, 7 days a week, you're able to go into that pharmacy and receive professional medical counsel. You're able to receive information about the medications you're on. You're able to speak and discuss your conditions, your symptoms with a licensed professional pharmacist. And that access is free to anyone who decides to walk into that door. Very different from any other professional licensed individual.
Yeah. So when you have independent pharmacies, obviously there are some benefits to the community, but being an independent pharmacist, you also have some challenges as well. COVID-19 has definitely impacted everyone, and particularly right in the borough of the Bronx, the hardest hit. But then you as an independent pharmacist, you've also had to deal with some financial struggles. Share with us a little bit about that.
So sure, as the pandemic hit, many independent pharmacies had to reduce hours in its efforts to help maintain social distancing, help, prevent people from being out and about at later hours. And so we had to reduce hours. Obviously, reducing hours prevents the amount of customers and patients that you are able to serve in any given day. As a result of the pandemic, we've also had to increase home delivery. And those are expenses and costs that an independent pharmacy picks up. Those are not expenses that are passed through to an insurance company. Those are not expenses that are picked up by anyone. There is no charge for our delivery service. It is free to our patients and free to the population that we serve. In addition to that, you also have an increase in patients who are looking for better ways to manage their medication, whether it's adherence packaging, whether it's medication synchronization, whether it's MTMs, where we're counseling patients on the medications that they're on. These are all different services that you're able to receive from your community pharmacy at no additional expense. And you take it a step further, not only is it at no additional expense to the individual who's receiving the service, it is an expense to the business owner who's running the business and offering those services. And we offer those services because we've entered this space. We've entered pharmacy, we've entered healthcare to take care of people. And that is what's our primary focus. It's why we keep our doors open every single day. It's why during this pandemic, not one day did Mount Carmel Pharmacy close its doors, because we recognize the responsibility that we have to the public and the community that we serve. Closing our doors it isn't a business decision, or keeping our doors open, is not a business decision. It's a decision based on the public and the community that we serve. Where will our patients get their medication? Where will they get their insulin, pain management? And you think of the list of other services that are offered from the pharmacy that patients rely on to live their daily lives. You close those doors, you close that beacon of hope to the community.
Give me this here, because when we talk about closing doors, it's a possibility for a lot of independent pharmacies, because you guys were looking for possible financial relief from New York State that has not yet occurred. Talk to us about that, the money that you were anticipating to help you to keep the doors open, but still has not yet happened.
Yes, absolutely. I believe, in New York, pharmacists feel deeply betrayed by elected officials in Albany right now, especially when it comes to the Medicaid fee-for-service program, which we were being told to hold on, that it was coming, and lo and behold, it doesn't look like it's coming. And the effect of that is it makes it difficult for a business owner to run their business in an unpredictable revenue model. Currently, the way it stands, we can't forecast budgets for the year. We can't make informed business decisions when we don't know how we're going to be reimbursed, when the predictability of that revenue model is unstable. And what that does is it leads you in a position where how much longer can you continue to keep those doors open? How much longer can you continue to be in the communities that you serve and be of value to those communities if you can't keep those doors open? When you're getting paid pennies, and I mean literally pennies, on prescriptions that you fill, it doesn't even cover the expense of the ingredient. And even if it does cover the expense of the ingredient, it doesn't cover the expense of where that medication is being put into, whether it's a bottle, flask. It doesn't cover the cost of the labels to put on that medication. It doesn't cover the cost of the labor that is involved, the pharmacist who has to review that prescription, check that prescription, the technician who has to count that prescription out, the delivery personnel that has to take that medication to the patient, and all of those pieces that occur behind closed doors, behind the scenes, to get that prescription that is prescribed from that doctor into the pharmacy, filled, and to the ultimate end user, who's that patient who needs the medication. There are many steps that go on before that actually occurs. And when you're not being reimbursed in a manner that can sustain that type of business model, it leaves you questioning whether you can keep those doors open anymore.
Yeah. And real quickly, I know that you've decided to give back to the community in your own kind of way. We got about a minute left. Share a little bit about the give back.
So we've done a lot within our communities with regards to COVID testing, with regards to COVID vaccination. During the height of the pandemic, we were partnered with the local Boys and Girls Club, where we were offering PPE packages to give out to the community and to give out to families who needed it and who didn't have the means to get it or the access to get it. So we partnered with local charity organizations such as that to help give back to the communities that we serve. We realized that the only reason we have the business that we have today are for those patients, are for those customers, and are for those individuals who live in the communities that we serve. They give us the opportunity to be of service and to be of value, and we thank them each and every day that we're given that opportunity to serve them.
Javier Maldonado, definitely great to have you on the show. Great work that you guys are doing, and hopefully we can see some good things happen for the people over at Mount Carmel who definitely need it in that community. Thanks a lot, buddy.
Thank you. Pleasure.
All right, now I want to let you know now, if you want more information, we encourage you, go ahead and visit their website at mountcarmelpharmacy.com. Again, mountcarmelpharmacy.com. Now we do have more show. Don't want you to go anywhere. Stay with us. Open will return right after this. Welcome back to Open. The Knowledge House is an organization that's closing the gaps in education to employment pipeline by leading digital skills, training and coding and design for underserved people, and particularly young ones, right here in the Bronx. We talked to Constance Barnes, who's the Director of Programs and Partnerships of the Knowledge House, and she gives us more details about their great work.
Good to see you. Thank you for having me.
Yeah, and so as we are, I mean, congratulations. We're trying to move a little bit further out of COVID, but the work still continues for you. A little bit more about the Knowledge House and the work that you're doing presently.
Sure. As you mentioned, the Knowledge House has been around since 2014. We're in our 7th year, and this year we're expanding. So we're really excited to be moving out into Newark, Atlanta, and Los Angeles. So we're super excited to be reaching out to new partners, expanding, reaching more students and more adults, and providing access to technology in places where they haven't had it before.
And when we talk about this digital divide, obviously in communities of color, low-income neighborhoods, they seem to be the ones that are predominantly affected by this digital divide. And you're pressing your assistance out a little bit more.
And so when we talk about digital divide, I think that COVID has really pulled back the curtain and shown us what's really missing in our communities, right? And when we talk about digital divide, I think it's very broad, right? It's about basic digital literacy skills. It's about having access to technology. We know a lot of people didn't have Wi-Fi. So one of the great things at the Knowledge House, not only do we provide our students with laptops, we also make sure that they have Wi-Fi access, right? Because we know that if we want them to be successful in technology, we have to make sure they're equipped with the basics. And then to further close the digital divide, we provide them with mentors, with volunteers, with tutors, and at the very end of programs, they have internships in technology. So we are truly closing the gap from the beginning to the end to make sure that our students are set up for success in technology.
Not just technology, there are different areas that you're also trying to help them with financially, emotionally.
Exactly.
So give us a little bit about the emotional, because students come and they're trying to be the best they can, but sometimes their bandwidth is challenged.
That's right. That's right. And so one of our actually core values is having a growth mindset, right? And we try to encourage our students to develop that, inherit that, and really believe in that. But one of the great things about the Knowledge House that's different from a lot of boot camps, we have case specialists who work very closely with our students. So we work with students on issues, if they have issues with housing, if it's about immigration, if it's just about figuring out where your next meal comes from, because we know the populations that we serve, we work together to do that. Our case specialists meet with students monthly. They have phone calls in between just to make sure, again, that students, like you said, are set up for success completely. One of my main roles as the Director of Programs and Partnerships is to build out partnerships across the city and across the nation with other organizations who can provide some of that wraparound service for us.
Yeah. And I know also that you're pretty big on scholarships. You're providing scholarships as well for students.
Well, it's a fellowship. So our programs are free. That's the other thing that sets us apart from other organizations. Our programs are free and students get a stipend. So when you think about other places where you're paying to go to school and you have to pay for a laptop, we don't charge anybody anything if you meet the requirements. So for our high school students, they get a stipend in the summer. For our adult students, or our 18 years or older students, they get monthly stipends. So again, we are making sure that we're not just addressing one issue. We are looking at a holistic student and providing them with the support and the resources to truly be successful in our programs.
When we talk about helping out students, it's really 40% of American students sometimes drop out because of financial need. And so how important are these stipends and programs such as this?
Many students are faced with the cost of college that, when you're a first generation college student and you come from communities that have been underserved, college is daunting. You may start and then you find out you can't continue to pay for it. That's what sets the Knowledge House apart. Our programs are completely free. We're providing those stipends to help support people because we know one thing about working in technology is that you have to practice. Right? It's not enough to just be in school and get the training. You have to have time to practice. But a lot of our students would need to work. So being able to provide those stipends allows them to maybe not work as much in those jobs that they would have had that are not related to tech, but actually be able to spend time working on their projects, developing apps, and doing more study so that they can be ready for those full-time jobs at the end. So, we take away some of those costs that students would incur if they were going to colleges, if they were going to other programs who charge, or some programs actually take a portion of your income. So the Knowledge House is completely different, right? In that we're free and we're providing support. And like you mentioned, not just financial support, not just laptop support, but really wraparound support to make sure people are successful.
And as we are literally on the verge of summer, what can your students and what can the community expect?
Well, we are in the middle of recruitment season, so I'm glad that you asked about that. We are accepting applications for both our high school program and our adult program. Now, the cool thing about the high school program, it runs along the same time as the summer youth. So students would be in the program for July and August. They get a stipend. They learn some really cool things about tech. And what I love about the high school program is they get business skills, like you mentioned as well, right? So students who are in our high school program will come out at the end knowing how to really set up some cool websites, maybe help some of the businesses in our community to be successful, and have a skill that they can take with them for their lifetime. For our adult programs, we're also recruiting, so the applications are open, and we are looking, again, for people in all of our partner states, but of course, start right here at home.
Well, Constance, it's been great having you on the show again. Thank you. Continue the great work at the Knowledge House, and hopefully you have a great summer.
Thank you. You too.
All righty, Constance Barnes. She is the Director of Programs and Partnerships at the Knowledge House. Now, if you want more information, we encourage you visit their website at knowledgehouse.org. And we also tell you, please don't go anywhere. We've got more open coming up right after this.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, and they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Well, throughout the year, Open Wednesday has continued to highlight individuals who inspired the community through different approaches. One motivational guest wrote a book about his life journey, detailing the courage it took to also be able to continue. Talks about his boldness and what it took for him to make it in society. We'll take a look at that segment right now. Joining me now and sharing more details is motivational speaker and author Jeff Williams. And Jeff, good to have you back here on the show.
Good morning, Darren. It's a pleasure to be back on the show. And thank you for having me and letting me discuss my book that I've been working on since the last time we've met. And one of the reasons why I wanted to come on the show is just to bring more exposure to the book, because I feel like it's something that's very important for a lot of people to read, because the book is motivational, inspirational, and it's about forgiveness. And I think this book speaks about forgiveness in a way most people have never forgiven before. And one of the other things that touched me with the book is from the people who have read it already, you know, it just showed them that no matter what you go through, no matter what challenges you're faced in life, you can overcome them and still progress and be successful.
Yeah. And I want to get an opportunity to talk to you a little bit about the book and your life, because, you know, you're very passionate about letting people know about your life story without giving away all the contents of the book, but give some people a little bit of background as to your life and where you are today.
Well, when I was 13 years old, I was accidentally shot by one of my friends playing with a gun. And where most people at 13 are going through puberty and on their way to high school, I was faced with a life-changing event. And it kind of put my future on hold, because after being shot and paralyzed, I didn't realize what my future would look like. I had no idea where I would go from that point. And it left me in a dark place where I couldn't see the light at the end of the tunnel at the moment.
And for you, obviously, it's been, you know, that experience itself is traumatic. That experience was life-changing for you. And you talk about walking around in a dark place, and then you had that turnaround moment. Share with us, what was the turnaround moment for you where you were able to engage in forgiveness and really being able to now be a voice for those who've actually had similar experiences and life's traumas?
I think the turnaround point was when I was in the hospital and I was coming out of recovery from one of the several operations that I was having to remove the bullet. And I'm laying on a stretcher and I have this young guy sitting next to me on a stretcher, and he looks at me and tears are running out my eyes. And he says to me, you know, why are you crying? And I looked at him and I said, I'm paralyzed. I can't move my legs. And he asked me, could I see my legs? And when he asked me that, at the moment, I thought the question really didn't make a lot of sense. And he removed the sheet from his legs. And I realized he didn't have any legs. He was in a train accident. A Metro North train ran his legs over. He was playing on the train tracks. And to see him with a smile on his face and not have his legs, it just made me realize that no matter how bad I think I am, there's always somebody who has it worse. And watching him and several other the kids that was on the hospital ward who had spina bifida, who had been paralyzed from their neck down with injuries that appeared to be worse than what my injuries were, it just showed me that, you know, so many other people are going through so many different things. We all have a story. We all have life challenges. So I didn't want to be selfish at that moment and only worry about or think about myself. So it kind of changed the focus of my life at that moment.
And so now you go on to write the book, and obviously your book is a life in the making, if you will. Share with us how long it took you to really decide to put it from pen to paper and to get it out there. Was it a long process?
It actually, when we went into that quarantine for the pandemic, I'm real active, so I'm not used to being in the house a lot. So I was sitting in the house and I'm wondering, what am I going to do with all this time? You know, I'm working from home. I'm home every day. We can't really go outside. You know, we have to be safe due to the pandemic. And I'm thinking to myself, how can I be productive with this time? And for years, I wanted to write this book and tell this story because I would go speak to different individuals who were recently injured. And usually when a parent called me to ask me to come and speak to their kid who was either from a gunshot wound, a car accident, things like that, that they ended up paralyzed, and they felt like I could be that voice to change this person's life. And I remember going to visit a young man by the name of Edward. And when I went in the room to speak to him, the impact that I had on him and the fact that I was able to connect with him through this accident that we both shared and give him a reason to live. When I left the hospital that day, it just made me feel like this story is more powerful than I actually know. It's actually something that is building people, changing their lives, making them reevaluate their situation and look at their future and not at what happened to them.
Yeah. And so as you wrote this book now, you have got it out and going. Talk to us about the process. You're out there right now. The book is out there. You've got a book tour coming?
Yes. One of the other things doing, like writing this book and putting it together, I had the honor of meeting my editor, Nelsa Crosby, and she had a writing course called Helping Writers Write. So I took the course, and during the course, I learned better ways and better strategies to write a book. And one of the things that stuck to me the most was I felt like she showed me how to bring details to life. And in the sense of, you know, when you look down the street or you're mentioning a scene, it kind of taught me how to bring my reader into the book with the details so they could actually feel and walk through the story as if they were me. And I was able to nail that. And I think that's what makes this book so special, because it takes you through the journey of that dark place that I was in, and it brings you to the light of when I transitioned into the success story.
Yeah, I can't leave without talking about Jay Lorenzo motivational sneakers. So you got some motivational sneakers out there, huh?
Yes, I also created a pair of sneakers, and each one of the sneakers have like a motivational quote in them. And I put the motivational quote in the sneakers, so when people wear my sneakers and they put them on in the morning, they actually read this quote and start their day in a positive way, because I feel like your life is basically the way you think. So if you think positive, then it kind of leads you into a positive day and makes you feel good inside. When you feel good inside, you feel good outside.
Well, I got to congratulate you again, brother. It's been great having you be with us. You know, you're inspiration to so many people. And I want to thank you so much for taking the time. And congratulations on the book and the sneaker line. And hopefully we'll get a chance to chat real soon.
Thank you so much, Darren, for having me today.
Jeff Williams, our guest back here on Open. Want to let you know, listen, if you want more information, I want you to go visit him. You can catch him on Instagram. He's got Shoes by Jay Lorenzo. You can find out about the book. You can find out about the sneaker line, and you can get connected. Jeff, again, great to have you. And of course, we're taking a quick break. Got more show. Open continues coming up right after this. And welcome back to the show. For over 70 years, Adapt Community Network has created a more inclusive world for children and adults with disabilities. Now, we had a chance to speak with the Senior Vice President of Program Services at Adapt Community Network, Dolly Porter, and she lets us know more right now.
Hey, Darren, thanks for having me, man. It's a pleasure.
Yes, and so for people who may not be so familiar, obviously you do a great job of providing services to those who have disabilities. Many people probably know you guys as United Cerebral Palsy before, but you're now Adapt. And talk to us about how you've adapted and the work that you guys are still doing in serving those with disabilities.
Oh, thanks, Darren. I mean, we're a cutting-edge organization as Adapt Community Network, where we provide services from pre-K children all the way up to adults. Services include education, we do summer camps, we do after-school programs. On the adult side, we do housing and provide folks with services in the community. So we do from housing from 24 hours a day to less than 24 hours a day. We also provide vouchers for people on rent subsidies. So if you live in a community, you need some special assistance, we could provide that. We also have a program called Home Access to Home, where if someone has an issue because of physical disabilities, where they may need a lift in their home or a ramp in their home, we can work with you on accommodating that. So we try to give the gamut of services. We really listen to the people we support, and it's really how we establish services. Also on the adult side, we have what we call day programs or day centers, where during the day you can come in and you can get services, and they're very personalized and they're catered to that person. So it ranges from community outings, supported employment, volunteer work, going out to libraries, but we really want to ensure people are part of their community.
And when we talk about serving the community, obviously this is a very vulnerable community as you deal with disabilities. Talk to us about COVID-19, because with COVID-19, I know a lot of people have had to pivot and change what they do. How has it affected those of your clients?
Oh, man. COVID was tough for us. You know, it happened so fast, right? So one day we're going as normal, the next day services are just different. So it really impacted our folks. And it took us a couple of weeks to really adjust. One of the things we did, and because we felt we lost contact with folks, especially folks that attended our day centers that were living at home, we lost contact, right, for a couple of weeks. So we actually started a morning show called WACN. It was just an idea of one of our staffs, and we just ran with it. Well, this way we were able to connect with folks. I think the first week, maybe we had 20 people participate. And right now we have about 150 people that participate in this program. It was just a way of really connecting to folks and making sure we got eyes on people. People saw their friends, classmates, things of that nature. From that, we really developed a platform, a virtual platform of services, because it was so unsafe to really come back into programs. We couldn't do that. So we have a gamut of activities that we do virtually, whether it's meditation, arts and crafts. We do cooking classes. We have physical activities, exercise classes. So we really had to pivot overnight. We probably issued over 250 Chromebooks and iPads so people were able to get in contact with us and stay connected through this virtual programming.
Awesome. And when you talk about making that pivot, obviously we're making a pivot right now. We're on the other side of the pandemic prayerfully. And now we're setting our sights on now the spring and ultimately the summer. I know recreation programs are also big for your clients as well. What do you offer by way of recreation programs, and what can people look forward to coming up this summer?
Okay, that's a great question. Thank you. We have a summer camp that we go to called Action Day Camp. We have a summer camp, which is awesome, so they can look forward to that. We have after-school programs that we're starting to gear up again, with schools getting back into action. We also have a Saturday disco program, and people get together, and it's more of a social atmosphere for folks, something different. So we try. So summer is actually an excellent time, and also as we talk about our day programs that have been closed because of the pandemic. In the summer is going to give us a lot of flexibility in the spring because we could do more outdoors. We have a campus on Stillwell Avenue in the Pelham section of the Bronx. So we'll do a lot of activities outdoor and really make a camp-like atmosphere for the people we support.
And you also do, as we have technology, and technology is key and crucial in this virtual age. And I know that you mentioned having getting Chromebooks out to those who are your clients and being able to service them. How hard of a task was that? And do you see this happening in the future?
Yeah, it was a very challenging task, because you could imagine everyone's trying to get devices, whether it's Chromebooks, iPads, laptops. Everyone's trying, but we give our IT department head agency. They did an excellent job securing these devices for the people supported. So it was just amazing what they did. And I just want to tap on something talking about technology. We also have a TechWorks department where we actually have a vehicle where we can go out to people's homes, disabled or not, and work with you on any kind of device you may be looking for. We have a loaner program. So those are things we can absolutely do.
So as you make this impact within the community, we know that 18,000 people have been serviced by what you do. I saw this amazing statistic because, and I really was struck by it. It says 92% of every dollar that comes in for you guys actually goes directly to programs and clients. And not every agency can say that.
No, and that we're very, we take a lot of pride in that. We don't have a lot of overhead. So our staff are staff on the ground, hitting the boots running. We try to give back as much as we can to the people we support, because that's our priority, right? Our agency was founded on families, and we've always believed in that. Although we may be much larger now after 75 years, we really try to treat it as a small market, mom and pop shop, where we try to really get to know everyone we support, and we take it one person at a time. Our empowering people through initiative solutions, one person at a time, and that's how we truly believe it. I want to go back to something that you asked Daren earlier, and I didn't answer you. As far as technology, one of the things we've learned during the pandemic, we have a lot of flexibility now, right? So everything isn't just site-based on the community. So now people have options, right, that we support. So they can still get service virtually, even once we're up and running fully and programs are open. We want to give people the opportunity to have that flexibility.
Yeah, flexibility is key and very critical. How much have you learned about flexibility? I mean, we're about a year into this right now, and I think when we talk to organizations and organizational leadership, they say that every day it's a learning experience, and there's a need to always be flexible.
Yeah, no day's the same, right? So as an agency, we were always big on technology, and we felt we were leading the industry in technology. But what actually happened, we had to speed it up. We didn't have a choice, right? So what we thought we would take 2 years to do or 3 years to do, we did it in months, right? So we created platforms for the education program, the adult programs, virtual platforms to make sure, we can connect, and we were forced to do it. So the pandemic was a bad thing, absolutely, but some good things came out of it. And with this was flexibility that we hope we can maintain moving forward.
Yeah. And so for people who want to get connected to the work that you're doing and maybe even do some volunteer work, what can they do?
Oh, man. They go to our website, Adapt Community Network, spelled out, Adapt Community Network. And just go to our site and you can link on, you can get to volunteer sites. You can learn about our programs. You can learn what we're doing around COVID-19 as far as safety protocols, gives you information what programs are open, what programs may not be open, but it's just a great resource of information. We're also on all the social media platforms, so you can find us everywhere. We've made sure that we've made ourselves available to the community.
Yeah. Well, great having you, Dalian, and we certainly appreciate the work that you do with Adapt. And of course, as you continue to go forward towards the summer, we'd love to have you come on back.
Okay, thank you, Dan. I welcome that. Thank you so much.
Right.
It was a pleasure.
Yes, sir. Well, now, for more information, we encourage you to do us a favor. Visit their website. The website is adaptcommunitynetwork.org, and then also follow them on social media at Adapt We Change. We got more shows. Stay with us. We're coming right back right after this.
If you're struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit, or call toll-free at 833-511-0311. That's 833-511-0311.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
And welcome back. Many organizations have actually worked to flatten the curve of COVID-19. And as a result, there was an increase in mobile testing as well as mobile vaccination. Project Renewal was just one of the mobile van providers giving comprehensive health services to homeless individuals. Recently, we sat down with the fleet manager of the mobile medical division at Project Renewal, Jermaine Pope. Let's take a look at that right now.
Thank you guys for having me. I appreciate it.
Thank you. And so for those that may not be so familiar, give us a little insight and share with us a little bit about the organization.
Well, Project Renewal is a organization that, like you said, not-for-profit organization that does provide job training, housing, and healthcare to over 16,000 homeless and at-risk New Yorkers every year. My part of that is the mobile healthcare unit. We have vehicles that go out and service the community to provide healthcare to this at-risk community all over the 5 boroughs of New York City.
So a little bit more about the mobile vans. So they travel around the city, of course. Talk to us about the target population and the services they provide.
Okay, so we target, like we said, the homeless and at-risk communities, and we go across all 5 boroughs. And what we do provide is primary care, just like your normal doctor's visits that you would take on yourselves, or you with your family, you would go to the doctor just to check on your colds or get your vaccinations. That's what we do on the mobile health, on the mobile health vehicles every day. So those are primary care vehicles, and we also have a scan van, which is a radiology vehicle, which provides free mammograms to women across the city, across all 5 boroughs of the city as well. They go around and take care of that at-risk population as well.
How have things been working given the fact that we are navigating still COVID-19? How's it been working for your organization?
as you can imagine, it's been a challenge. I think it's been a challenge for every organization out there, especially in a global pandemic, which nobody has ever been in before in history. So in our time anyway, but we have not stopped working since the pandemic started. So we have been out there reaching out to the community and being partners with our community outreach partners as well, going out there and trying to reach this community, trying to get everyone who is at risk to know what their health baselines are, and know that they are, what options they are of getting tested for COVID-19, what options there are for COVID-19 vaccinations. We're out there really heavily educating people and educating this community, and making sure that anyone with underlying conditions is being seen by us and being taken care of on a daily basis, because that is really the crux of where COVID-19 really affects this community. If you have like underlying conditions such as diabetes or hypertension, COVID-19 is really, really hard on you, especially so. And we know that the homeless and anyone who's at risk in this community, they are at risk for catching COVID-19, and any other underlying condition would make that COVID-19 diagnosis that much worse. So we're out there making sure that people are getting their medications, making sure people are getting tested, and make sure people are getting the medical care that they need every day.
Yeah, and when you talk about those COVID-like symptoms, obviously, a lot of people are struggling with that. I know your mobile van also travels to deal with people who are dealing with the COVID-like symptoms.
Absolutely, absolutely. So we have a process when we deal with that. So we do see people with COVID-19 like symptoms. Initially, when COVID first got on our radar in New York City, there was a seriously high uptick of people that had COVID-19 symptoms, and that kind of cross brands with other conditions as well. So we had to kind of pare it down. So we said, anyone who has fevers, who has chest pain and cannot breathe, we need to get them to the hospital immediately. So we paired up, and we made sure that with our sites that we go to, we made sure that we got people who had those multiple symptoms, get them to the hospital, get them to EMS, and get them treated as soon as possible.
Yeah. The vulnerable population is the homeless, of course. We know those who are in communities of color sometimes are the most vulnerable populations as well. Homeless, and then you got 65 and up. How's it been for you really being able to reach this vulnerable population and having access to really get to these people during this time?
Well, I can't say it's been tough, but it's been a challenge. Again, we have great community partners that we work with, and we know that in certain areas of the city, we know that we're going to reach a good portion of people who are at risk and people who need help, and especially the homeless people. So we know that we're going to reach them, but the challenge is getting them to be comfortable, getting on our van and telling us, what's going on with them. And that's a challenge. So it's important for us to be there every day. And that's one of the main things that we stress, is that we're there every day. As part of my role is to make sure that these vehicles are on the road every day, being at these sites, and that we are a recognizable force out there, and that they know that we're their help. So once we break those barriers, that they know we're there to help them and not there to harm them, and not there to create some type of test on them, or be some type of outside force that's going to hurt them. Once they know that we're there to help them, then we can delve into their issues, and they can tell us whether or not they're diabetic, and if they're taking their insulin, if they need insulin, and they can come to us weekly, daily, and get their insulin if they need that, or if they have hypertension and they need that blood pressure medication. So when they come to us and we have broken down those barriers, then now they can come see us about those issues that they deal with on a daily basis. Because as you know, when you're homeless and when you're at risk, you don't know where your next meal is coming from, now, regardless of your next doctor visit, or when you're going to get that next bit of medication that you need, or that insulin shot that you need. So we play a very vital role in making sure that this community gets the medication that they need on a weekly and daily basis, so that they don't have to go reach out to ERs and stay stuck in the ER for 10, 12 hours. They can come to us and see us, and we'll take care of them, and we can alleviate some of that pressure in emergency rooms, and alleviate some of that pressure on the nurses and doctors there as well, and alleviate some of the fear that this community has in reaching out to people and trying to get help because they've been rejected and neglected for so long. So now that they know that there's a force that's out there helping them, so they know that we're there for them.
Yeah, we know that when it comes to healthcare, that there is a disproportionate number in terms of statistics, and statistics heavily, there's a segregation, if you will. We know that when it comes to communities of color, they're last sometimes in the field of healthcare, and trust is a hard thing to kind of build. Give us a little bit about that trust. You spoke a little bit about that earlier, about building that trust and how much it takes to build that trust, so that way you can have these conversations and give people the services that they really need.
That is a big component of what we do. So on our vehicles, we do have outreach staff, right? So we have our outreach staff and some of our drivers and some of our providers. We go outside of our vehicle too. We just don't pull up to locations and just sit in the van and wait to see if somebody knocks. We actually go out and engage with the community, and we engage with people who are with our community partners and with people who are outside on the street if necessary, or on a soup kitchen line. And we go out and we speak to them. We let them know what our services are. And I think one of the biggest components of that is just letting people know we're always going to be there. So if we're going to be at a certain location on a Tuesday at 9 a.m., we're going to be there every Tuesday at 9 a.m. And we're going to have the same message. We're not going to change messages. We're not going to flip-flop. No matter who you're dealing with, we're going to let people know, hey, we're here to help you. This is a service here that you can utilize to get your medication, or to be seen, or to get a vaccination, or to answer any questions that you may have. Hey, matter of fact, if you just want to get on and have a conversation with us, sure, if we have time to have a 5-minute, 10-minute conversation with you, we will do that, just to break down those barriers, because it's really, really hard for someone who's at risk or someone who's been homeless, especially long term. It's really hard for them to trust some of the social services that exist out there. Sometimes they believe, sometimes they don't believe, sometimes they think it's just a temporary fix and this is just going to go away. But we believe in going out there and being consistent every week, every day, as much as we can, to be out there and let this community know that we're here for them.
Yeah. Jermaine Pope, who is the fleet manager of the Mobile Medical Division at Project Renewal. Thank you so much for being with us, Jermaine.
Appreciate that, Daren. Thank you very much for having me.
Hey, keep hitting the streets, brother. Keep hitting the streets. Thanks much. Listen, want to let you know, for more information, you can visit their website at projectrenewal.org. Once again, projectrenewal.org. Also follow them on Facebook and Twitter at Project Renewal. Again, thank you to Jermaine Pope. And yes, that about wraps it up for this very special edition as we look back at the best of Open 2021 right here on Wednesdays. Well, we want to let you know, if you missed any part of today's show, you can catch the recablecast here on BronxNet Television and anytime on the web at bronxnet.org. For all of us here on the Wednesday Open, I want to thank you for watching. Also for our producer, Latricia Burton, who's put in a great job throughout the course of this year, helping us behind the scenes to bring you all the guests, all the scripts, all the information that we have here on the show. A very important part. So for her, as well as myself, want to thank you. We want to keep you informed. Join us in the new year as we'll continue to bring you the best of current events and all that's happening in New York City and the Bronx from a Wednesday Open perspective. Make sure to keep this channel wide open. I'm Daren Jaime saying take care, God bless, and have a happy new year.